Thank you, Dr. Graywall and Dr. Chen, for those insightful presentations, and thank you to Dr. Lee and the supportive care panel for such an important and compassionate discussion. In this next section, we're going to focus on navigating surgery and local regional therapies. Mary, I'd like to hear from you. One thing patients quickly learn is that expertise matters, as you highlighted in our previous discussion. How important is it to seek specialists who truly understand neuroendocrine cancer?
I mean, I would say there's literally no more valuable piece of advice that I can give. It's the most shared recommendation I give to any patient I ever come in contact with in our net world. And you can love and trust your local oncologist, and they can still be part of your team. For instance, maybe doing the monthly injections or labs, but you need a neuroendocrine cancer specialist on your team. It's such a unique cancer, and the standard diagnostic tools and treatments just don't always apply. I mean, I have talked to patients that have had needless surgeries and or treatments, and if their doctor was well versed in neuroendocrine, they would have known that that wasn't necessary, or even patients that haven't received surgery when that would have been their best course of action. So I really believe that in my experience, the long-term outcomes and quality of life for patients are much improved when they have a neuroendocrine specialist as part of their care team. And that's one of the reasons I feel very lucky to have Cedars-Sinai and Dr. Hendifar on my team.
It's clear it's important to you. Thank you, Mary. Dr. Hendifar, I love that in our previous discussion, you highlighted how the changing landscape has also changed the members on the team that's taking care of patients. So patients are often told that they need a multidisciplinary team, but they may not know what this word means or how to find one. Can you further expand on what this word multidisciplinary means, and how do patients find multidisciplinary neuroendocrine cancer care?
It's really it's an organization of specialists who focus on neuroendocrine tumors, and it's a back and forth dialogue. And currently, most of the teams that exist dialogue in an organized way with a tumor board, but they don't have to use a tumor board. It can almost be, people who talk to each other regularly. If you have a surgeon, an oncologist, radiologist, nuclear medicine, if you're talking together and going back and forth, discussing the peculiar characteristics of a case, offering your expertise to the rest of the group so the best decision can be made, that's what I think of as a multidisciplinary team. In the modern sense, it usually revolves around a tumor board, which is an organized time of day where cases are discussed, pathology is reviewed, imaging is gone over, and all of the members of the team are present and offer their input onto the case in order to help make the right decision for the patient. Now, without all the team's input, you could overlook expertise or unique aspects of the case that a certain professional would bring. So therefore, right now, most of the major centers that treat neuroendocrine tumors do have an organized tumor board, although it's probably not necessary to have a team, but a tumor board is probably the best way to get a team together and to get actually, document what the recommendation is so that everyone in the organization on the team can see it, and to make sure the patient's care is going forward appropriately.
Thank you so much for your explanation. And now we're going to introduce our next set of speakers.
Yeah, before we begin with our next medical presenters, we're going to hear from a special neuroendocrine patient and caregiver from Sarah and Quentin, and who were recently married.
Next, we'll hear Navigating Surgery, presented by Dr. Julie Halle, surgical oncologist at Odette Cancer Center, Sunnybrook Health Sciences Center, and associate professor of surgery at the University of Toronto. Following that is Navigating Liver-Directed Therapy, presented by Dr. Michael Solon, who's the director of interventional oncology at the Abramson Cancer Center and professor of radiology at the University of Pennsylvania.